All right, Breck, thank you. And I think so many of us are in the middle of an emotional storm, a psychological storm. New at noon, we are learning about a resource that is available for Utahns to help with mental health self-care. And we're joined by Eric Tadahara, the Assistant Director of Children's Mental Health at the Utah Department of Human Services, live via Zoom. And we're so glad that you're with us to teach us about this app that you are providing. So first of all, an app. What does that do?
So the great thing about this app, MyStrength is available on a web-based platform. It's also available on iPhones and Android phones as well. And it's meant to be a self-help resource. It's meant to help empower individuals who are really trying to make sure they're maintaining their mental and physical well-being. Especially important today with a lot of the social isolation and the concern we're dealing with stress with COVID-19.
So if someone, you can get it on your computer, you can go to the website to use it as well. So how do you do that? I mean, I use an Android phone. Do I just go to the Google Play Store to find it, or what do I do?
So if you're on your computer, all you need to do is go to mystrength.com. Just spell like it sounds. MyStrength.com, and then it'll give you some prompts in order to create an account. If you're on an Android phone or an iPhone, you just go into the app stores on either platform.
Yeah,
you do the exact same thing.
And it's and this would normally cost money, right? But this is but we can get access. The state is providing free access.
Yeah, so normally this would cost some funding or some money. We've been working with the application actually and the developers to create a free 60-day trial for Utah. We've been able to identify this as being a really helpful resource, especially during these times. And we've also been working with the app developer to also have a longer-term platform as well.
And you know, I've been looking through it. And it looks like it has some really not just good advice, but it kind of walks you through action steps and things like that. But I guess what I want to hear is it kind of gets your seal of approval. Mental health professionals have looked at this, and it's you know, it's not a gimmick or something like this. This is something that you think can help out as a first step, huh?
Absolutely. So we've done a lot of research in order to make sure that this is well researched itself. It has evidence-based tools within the application, which is very helpful. And the evidence-based tools are things that really are helpful for things related to mental health, substance use disorder, parenting. They're really helpful from really age 13 and up. And I think it's an effective tool that we at the division, as well as other mental health providers across the country, have deemed to be adequate and helpful, especially if you're already going into treatment yourself.
Okay, and everyone at home, there is just this has hit everybody like a ton of bricks. No shame at all in seeking help. Sometimes people just feel like, I'm strong, I don't need this kind of thing. Eric, thank you so much. I noticed there's an access code. You can get that on your website, and we will also, we'll get this some information about this onto our website as well, if you go into the coronavirus tab, and we'll get that on there soon so you can make sure you know how to access it. Eric, thank you. Eric Tadahara.
Thank you very much.